I've been in the Washington area for about 34 years, and I have thousands of patients that I've operated on, so many people seek me out to do their gynecologic surgery. My name is Dr. Jeffrey Lin. I'm Director of Gynecologic Oncology at MedStar Georgetown University Hospital. A gynecologic oncologist is a subspecialist in obstetrics and gynecology that specializes in the treatment of gynecologic cancers. This includes ovarian, uterine, vulvar, vaginal cancer. So the most common benign gynecologic conditions that a person might seek me out for are uterine fibroids. Sometimes the patients have had a lot of surgery or their fibroids are enormous. Endometriosis, pelvic floor issues, pelvic pain, pelvic infections. Ovarian cancer, very deservedly, has a very fearsome reputation. The main problem with ovarian cancer, besides being an aggressive cancer, is that the symptoms are very vague, and often the cancer, when it's diagnosed, has already spread considerably. Surgery is an important part of the treatment to confirm the diagnosis, to do the staging, to remove the deposits of tumor. And what that does is it allows any kind of subsequent treatment like chemotherapy or targeted therapy to work better on smaller amounts of tumor. This combined approach is what's really led to having an improved outcome in patients even with advanced cancer in the 30+ years that I've been doing this. I think what's changed in the 3 or 4 decades that I've been doing this is really that we got much better at doing advanced surgery. The other thing that's changed considerably is the integration of minimally invasive surgery into oncologic surgery. So for instance, most uterine cancer that we treat now, probably about 80 to 90% of it is treated with a minimally invasive approach, usually with robotic laparoscopic surgery. So what that does is it allows the patient to have a little bit less pain and a faster recovery so that they can get started with the next type of treatment sooner. With the medical therapies, we have many new chemotherapy drugs, but beyond that, we also have targeted therapies, and there are immunotherapies being incorporated in G1 oncology treatment as well, primarily for uterine cancer. For younger patients that haven't begun their family or have completed their family, we try to be very aware of what they want. And so we can sometimes tailor the surgery to do less invasive surgery, maybe preserve parts of the reproductive tract to allow them to reproduce normally on their own. Sometimes we can refer them to reproductive specialists that can do egg retrieval and freezing that allow them to have maybe a surrogate carry their pregnancy later on. And so there are many, many different options. As a person that knows all facets of the treatment of gynecologic cancer, I think I'm actually very well suited to be the primary person to help answer the patient's questions and direct them to the right place. I'm always available to answer questions, render an opinion. I really want to know as much as I can about that patient and their family and their circumstances besides their cancer. And so I really want to know what's important to them so I can help guide them and their journey in treatment for cancer.